Okay, ready. Cool, so we've arrived at the scene of a 40-year-old male. He's fallen out of a tree. We have strong reason, therefore, to suspect traumatic injury. The scene looks safe and clear. Tristan, are you happy to proceed?
Happy to proceed.
Okay, let's go. Hi there. Hi, what's your name? Cool. The patient says his name is Ron. That's a nasty looking laceration. It's about 10 centimeters deep. Could you please hold on to that and apply pressure as much as possible? So Ron, could you tell us a little bit about what happened today? Yep. So the patient tells me that he fell out of a tree while he was trying to cut down some branches. Can you just hold that gauze there in place, please, Tristan? So he was trying to cut down some branches and he fell. Patient expressed no dizziness, no loss of memory during the incident, so we can possibly rule out a glycemic incident, hypoglycemic. Yep. Yeah, that's good, Tristan. Could you please get on to a rapid trauma sweep for me?
Yep.
Excellent. So, in order to apply pressure with a bandage, I can just sort of twist it around like this every so often. Make sure that the twist is done as proximal to the wound as possible. Okay. So, do you have any medical history that we should know about? No? Any allergies? No? Okay. Cool. Nearly done.
No.
Off this bandage.
No new blood.
No
Right
new blood?
angulated ankle.
Right angulated ankle. Okay. Yeah, I can see that from here now. It looks pretty bad. Could I please get you to assess some vital signs, particularly blood pressure, temperature, and respirate?
Yep.
Cool. And Ron, what's your pain like at the pain scale at the moment? A 10? Okay. So yeah, you'll need to prep some methoxyflurane after this.
Sure.
And I'll just get that to 1K. Because the blood has slicked through this bandage so quickly that I think I need to control the bleeding as much as possible, as quickly as possible. So, I'm going to quickly assess his pulse. Yep, it's there, but it's present, but it's slightly weak due to the trauma.
Methoxyflurane, 3 moles, expires April 2020.
Okay, we'll check that in a second, Tristan. I just have to get this 20K on. Cool, so to get a 20K on,
I'm just going to take your temperature, Ron.
you just pull it taut as much as possible, Velcro it, and then to make sure it's as tight as possible, you tighten this windlass and you just keep tightening it until it basically will not get any tighter. And once you've done that, you stick it into the slot there, you tie it off, and you write down the time, so 3:30. Okay, Ron, now that I've done that, I'm just going to check the bandage to make sure that the bleeding has stopped. Whoops.
Temperature 36.8. Got that for your arm, Ron.
Excellent.
Just going to tighten up a little bit there, Ron.
Okay. Yeah, that's pretty good. I can see that the patient's bleeding has mostly stopped. Now this is what I would have called a venous bleed instead of an arterial bleed. I could tell because the blood was oozing out rather than pulsing out in time with the blood, and it was dark rather than bright red oxygenated blood. Yep. Distal baselines, yep, they are basically non-present thanks to the 20K. Ron, can I just get you to keep your arm elevated as much as possible? And now we are going to go into the methoxyflurane. So Tristan, did you say it was 3 mils, expires April 2020?
The methoxy, yes, 3 mils, April 2020.
Okay. So do you have any history of renal impairment? Nope. Do you have a history of malignant hypothermia? Nope. Okay, that's good. No allergies. I think you told me that there was no allergies. Have you seen this? No, you haven't taken methoxyflurane in the last week? Okay, that's good. In that case, can I get you to hold on to this with your good hand and make sure you inhale it and exhale it into the green whistle. So very important, inhale through the green whistle, exhale into the green whistle, because you don't want to get us high from the fumes. So what were the vital signs, Tristan?
Blood pressure was 120/80, temperature 36.8,
Okay.
rest rate of 16, and pulse of 100.
Okay, those are all pretty normal vital signs. I was especially worried about blood pressure, temperature, and rest rate, because when those first two go down and that third one goes up, then that's a sign the patient is going into hypovolemic shock, which is a very bad sign. So now that you're puffing on that methoxy, I will do a secondary survey. It's important to note that when I'm administering methoxyfluorine, I will need to note down the 5 R's. So, alright, patient, drug, dose, time, and route. So this is Ron, methoxyfluorine, 3 milliliters. It's being ingested by inhaling it, and the time is 3:30. So I will note those down at the end of the shift on the patient referral. So Ron, I'm just going to do a secondary survey now, which means I'm going to pat you down, looking for any signs of additional trauma. If you experience any discomfort, any pain, let me know. Cool. So just feeling top of the skull, the occiput, no crepitus, no bogginess there. Cheeks, mandible, no, nothing there, no fluid in the nose. Eyes look pretty okay to me. There's no dilation or unevenness there. No fluid in the ears, no bruising, no bruising. That's good, so that's a sign that there's no base of skull fracture. The neck, I'm just going to palpate and... Oh, you say there's some pain there? Okay, so he's got midline cervical spine pain?
Yep.
That means we will need to sort out a C-spine collar, so could you please get on that?
Sure.
And once you've sorted it out, could you please keep his head as still as possible?
Yep.
Excellent. Okay, so just keep huffing that methoxyfluorine on, and I'm just going to palpate your arm.
C collar ready.
Palpate your hand, sorry. Cool. Alright, now I'm going to, can I get you to inhale, exhale. Okay, there's no asymmetry in the lungs. No pain in the ribs, at the side. Palpate the stomach. No rigidity, that's good. Palpate the pelvis, nothing in the pelvis. Femurs. Okay, that's good because the pelvis and the femurs can both lose quite a lot of blood. Alright, I'm just going to keep palpating down until we can get to where the pain spot is. So, just let me know, is it here? It's there, okay, cool. So, yep, that looks like it could be a fractured ankle for sure. I'm going to feel this tibia and fibia here. I'm just going to feel your foot because it looks okay to me. Yep, no pain there, excellent. Alright, so I'll have a look at that foot in a moment, but first I want to get the C-spine on. So we use one of these when the patient's neck needs to be immobilized due to a suspected cervical spine fracture of some description. So Tristan, yep. You ready?
Ready.
Okay, to measure it, I just need to take the number of fingers, count from the chin to where the trapezius meets the shoulder. Cool. And then I take it here. Looks like I've already got it set, got it to the right setting. So on 3, can you lift his head up, please, Tristan? Yep. Okay. 1, 2, 3. Okay. Now. Excellent. Yep, you can let go now, Tristan. Cool. And, once that's just going to keep you immobile, and you'll be fine. Hopefully. Is just to make sure that it's immobilized and kept as safe as possible until you reach the hospital where it can be properly looked at. I'm just going to get you to lift his head up again because I want to place this towel under it. Yep. Okay, on 3. 1, 2, 3. Oops. There we go. Okay, cool. What that does is it just keeps the airway decently aligned, and it also keeps the spine and neck in a neutral alignment. So, very good. Just keep puffing that methoxy, Ron. How's your pain at the moment, by the way? It's about a 7? Okay, good. Do we call for backup for the tourniquet?
I haven't, no.
No, okay. We'll need to call them. Hi, AET to comms. Could we please get some backup pain anesthesia from some paramedics? We'll need some IVs such as morphine and fentanyl. Okay, excellent. Yeah, so your pain should be getting better very soon. I'll just get a pillow out for the splint, just in case we need one, but I need to assess this first. So, I'm going to feel your pedal pulse in both feet. Okay. Yep, slightly weaker in that one. Can you wiggle your toes for me? Yep, okay, you got good movement in there. Can you feel that? Cool, you got good sensation. Cap refill. It's a bit slower in this one, that's to be expected from the trauma. Yeah, discoloration, swelling, it's a bit swollen and discolored here compared to this foot. So what I'm going to get you to do, Ron, is I'm just going to get you to keep huffing on that methoxyfluorine, and we're just going to put your foot in a pillow splint. And that'll help to immobilize your foot and keep it as comfortable as possible. Okay, Tristan, I need to get some transport tape actually.
Got it here.
Oh, you got transport tape? Excellent. Good thinking. Okay. So, can you please put one hand under his knee and get the other hand ready to place a pillow under him?
Yeah.
And I will get two hands and lift his ankle. Okay? On 3. 1, 2, 3. Excellent. Very well done. Awesome. Yeah, and all I need to do now is wrap the pillow around. Tristan, could you handle the sellotape for me, please?
Yep.
Thanks. Excellent. And yep, just one more here.
One down the bottom.
Yep. Cool. Yep, that looks fine for the time being. And while that's like that, I'm just going to reassess your distal baselines again. Cool, pedal pulse still present, still fine. Cap refill is still slightly delayed, but still fine. Okay, so that looks like, yeah. You think that's everything, Tristan? Do you think we can take him to hospital now?
Yep.
Okay. All right, we'll just prepare the scoop and then we can get you onto the stretcher and into the ambulance, sir.
Cool. I'm gonna get that.
Fantastic. Awesome.
I just hit stop.
What did I forget?